I was sitting here with Paul. Paul, we did the human cellular tissue program on his low back. Paul, one of the questions I like to ask people is, how skeptical were you when you were thinking about doing this? What were some of the things that were going through your head?
Well, the pain had progressed enough to where it was consistent, and I was very skeptical of any type of program. But in doing my own research, of course, you find out that some of these programs do work, and there's a lot of favorable things. So I'm not opposed to trying something different to help avoid a surgery or any further type of happenings. And I was very skeptical. I mean, one, fear of needles. So anytime you're dealing with needles and then you start talking about taking my blood, I mean, that's a fear in itself.
It's mine.
Right, yeah. And then giving it back, that's even weirder. And then just the whole process. So we're not in a medical facility.
Right.
And I know things are going with outpatient and the way that things work, but that all led to a lot of skepticism.
Concerns.
More concerns.
Yeah.
More concerns. The skeptical part was, is it mojo? Does it work?
Yeah.
And you can hear a lot of testimonies, but you really don't know until you experience it.
Until you do it yourself.
That is correct.
And then a lot of times patients have this a specific type of pain, and they feel like it's, hey, nobody else has this pain, and this is my pain. Nobody else has ever had this before. Is it really going to work?
Right.
You said something to me earlier about how you had pain, and then it was gone. Can you say that?
So immediately, at the procedure, it was it wasn't as painful then. I mean, you're getting some shots, and sure you can feel it, and sure it hurts. It increased. The pain increased. Pretty bad for a couple days, and then I think I did it on a Friday or a Thursday, and then about 3 days later started getting better. By the fourth day, it was freaky.
What do you mean by that?
It was I had serious transition pain. I mean, like
going from a seated to a standing. Is that
that is correct, or vice versa, or the opposite, or just movement in general. I mean, it took me a minute to stand straight, as you know.
Yeah.
And now that disappeared in like 3 or 4 days.
It was just gone.
It was gone. That pain was gone, and that was the weirdest thing, because I mean, it was, you go from having the pain, then you get this injection, and then you go to a lot of pain, and then it's gone, and it's really strange, and you don't want to mention it. Yeah. Because I don't want to be the guy that's claiming UFOs are flying around, like hey, I had this shot, and you'll never guess. But it really is a whole outlook on life. It's a change, because those things that you expect, that old friend pain, and I'm pretty pain tolerant. It's not there, so it's really good. I still have a little bit that we're working on.
Right.
And
I showed you a stretch to do to help out with that.
There's no reason to think that that's going to disappear as well. It's just, I saw the immediate effects, and now I'm greedy and needy and want that gone too. But I mean, it's been like I said, that whole transition, the sitting and going to there, and the screen time, as you call it, which is more now than ever.
Yeah.
It really helps with overall that whole thing.
If somebody was thinking about doing this, what would you tell them?
I tell them to give it a shot. I said, it's not. It is economical when you look at the big picture. Insurance and whatnot, it's going to take care of the surgery. Yeah, but it doesn't. I mean, and it's a long-term recovery. It's a long-term health. This is something that it's not. It's hard to explain. So it's not necessarily just an injection. It's a lifestyle change of actually being healthier and enjoying being healthier, because I'm not in pain.
Right. You can actually do things.
I can actually do things,
right.
and there's that looking forward for more stuff that I can do. So you have this huge excitement and everything like there, and overall, it's a good experience to do. There's plenty of you can read everywhere you want. If you don't believe what you see. I mean, there's plenty of evidence that these procedures do work and do help, and there's no reason to have that skepticism.
Good, good.
Yeah.
If you have any questions with Paul's procedure, what he's doing with his low back and his leg, you can call 636-239-5252. Thank you.